This is Dr. Benzinger on Health with secondopinion.org with our educational session on B2, Riboflavin. It's one of the B vitamins, and frankly, we like to cover what a vitamin is. A vitamin is an organic substance that is vital for life. A majority of vitamins cannot be synthesized by the body. You don't get it in your diet every day, you're going to be deficient, and dysfunction starts to happen on a cellular level, which can affect your health. Thus, diet or supplementation must be added for your best benefit. A water-soluble vitamin such as B-complex, vitamin C, do not need extra fat or other items to absorb it, as for carbohydrates, fats, and other things like that. So what we know is there are certain synergists that we're going to talk about later that make a difference on the use of this vitamin, but specifically fat has to be present for those vitamins that are fat-based. B vitamins are water-based and water-soluble, thus you don't have to worry about that one issue. And we cover it in every session so you get a clear idea of those things that you have to supplement extra to be able to make it more effective and more efficient. So when we look at the B vitamins, we look at the synthetic versus natural because that's a really big issue. Riboflavin is a component found in the following two coenzymes. Just suffice it that I'm putting it up on the screen, and I'm going to say the words, but you don't have to remember them because most of them will actually be written in their their moniker, FMN. Flavin mononucleotide is one of them, okay? And flavin adenine, okay? Adenine, or either way that you want to say it, dinucleotide. You're not going to remember half of that. But the point of it is, if you see FMN or FAD, that's the most natural form you're going to find this in. Riboflavin is used as a cofactor in over 50 enzymatic reactions in the body, so that is extremely important. And if you're taking medications or on a diet that is making you deficient in riboflavin, it can affect you drastically. You'll see from the screen that I always put up a picture of natural looking, such as ascorbic acid and natural vitamin C. If you just look at that first one on the left-hand side of your screen, you'll see this drastic difference in color. Well, the reason why is nutrients that are devoid in food cause illness because these nutrients are necessary, and look how attractive they are. You want to try to take them in as natural form as you can because they're attractive, they're healthy, they're nourishing, and they're bright and colorful. For those of you that are spring and summers, let's put it that way, those that dress code spring and summer. Okay, synthetic and natural, let's cover it a little bit more. Most forms of vitamins are processed out of their natural form. It is very important that to take a nutrient with other synergistic nutrients that make them work best, and we're going to cover which ones those are as for riboflavin. And without the synergistic nutrients, including the ones that are within your body, so if you've got a synergist that needs to be with it, in other words a helper that needs to be with B2 so it's most efficient, and you don't give it to it orally on a daily basis, then whatever is in your body eventually burned out, and you'll create other nutritional deficiencies because you haven't supplemented completely. Okay? There's 2 points of view when we look at synthetic vitamins comparison to whole food. The bottom line is eating whole foods that have all the nutrients in it is paramount. If you've not watched Secrets of Vital Health, you'll notice that majority of time, the majority of Americans into the 80 percentile probably are not getting all the nutrients they need from the foods they eat for various reasons that we won't go into here. So the bottom line is, would I rather you do that? The answer is yes. Is it almost impossible in today's society? In my opinion, I think so. What happens when we synthesize vitamins into a pure form? All these synergistic elements and other factors that need to be there for a whole food to be present isn't present. You'll see from this picture of broccoli, just all the elements that are in broccoli. Look at apples. You know, an apple a day keeps a doctor away. Maybe somebody was really bright and figured out that a simple, small, medium-sized, fist-sized apple has vast nutritional superiority over most things that we could give you supplement-wise. So eating these types of foods is a major issue. And if you want to know what types of foods that you want to eat, you might want to get our seminars on carbohydrates, fats, proteins. We break these things down and give you a very concise overall view of all these things so that you can start making better choice based upon good information, most recent information, and make good choices for your own health. Here's the synergist that we've been talking about. other B vitamins. I always tell people don't take B vitamins by themselves. Many times B6 for, let's say, an elbow problem, a tennis elbow problem. It's something that's healthy for you. The problem is if you don't take it with a synergist, it's less effective, and you may burn out some of those other B vitamins that you need. Vitamin C, that's another issue. Need to have that in your supplements or with your B2 riboflavin supplementation if you're going to get the best benefit. Deficiencies might look in the following manner: is that cracks on the sides of your mouth, sometimes in your around the nose area. You open your mouth and it cracks and it bleeds, it hurts. That riboflavin is one of those factors. There's another B vitamin that we'll look at later. Inflamed tongue, always swollen, inflamed, tender, reddened spots, reddening of the eyes on a recurrent basis. Vision problems can be a problem. Poor digestion, dizziness, hair loss. I guess maybe I need to look at the riboflavin problem if it's not genetic, let's put it that way. Insomnia, poor sleep quality, cataracts, dermatitis, skin diseases, nerve damage, decreased neurotransmitter production, retards growth in infants and children and needs to be there, and energy production and tissue repair, very dependent upon B2 riboflavin. Food sources, organ meats such as liver, milk products, whole grains, not enriched whole grain products, whole grains, okay? Just so you know, the new game is we don't call it enriched white flour, we call it enriched whole grain flour. It's not whole grain, folks. If it's enriched, it wasn't whole grain in the first place. They wouldn't enrich it otherwise, okay? Green leafy vegetables, eggs, mushrooms, broccoli, asparagus, and fish. The risk group is athletes. The more athletic you are, the tendency towards riboflavin deficiencies start to occur. Fetus, just baby, just being a baby, for some reason is a risk to be B2 deficient. Elderly, we know over 65, it can reach exponential values of 80 and 85% of that population. In teens, poor diet, not much sleep, at college, drinking, eating, pizzas, blah, 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 blah. Bottom line is B2 deficiency is common. Here's the nice thing. Toxicity basically is just not reported. Hard to find B2 deficiencies. Now, if you're a female that's on oral contraceptives, okay, B2, you're going to be getting more deficient. Here's the problem. When you're on certain medications, B2 deficiencies are going to be induced by the medications. Even if your diet is wonderful, you might have to supplement higher to compensate for certain antidepressants. You'll see there's a few antidepressants on there, tricyclines, certain antibiotics, certain antivirals will play a role. But oral contraceptives, you can be pretty guaranteed it's going to affect you. B2 is frankly damaged if you're taking your vitamins in the morning and taking a big swig of coffee. The caffeine alone might damage the B2. Not a good way to take it, okay? Light can do it if B vitamins are left out too long on the counter and they're exposed to light too long. And alcohol. So you don't take it with your beer and you don't take it with your coffee. Let's put it that way, okay? Recommended daily allowance. Do I think this is the optimal daily allowance? The answer is absolutely not. I think this is the minimum to stay alive. That's what USRDAs are. Again, secrets of vital health. If you've not gotten it, please get it. It will be a rude awakening, but a great awakening so that you know really what's going on in our general wellness related to nutrition and clarify some of the questions that frankly are being passed around in the media that I think are really confusing people. 10 to 15 milligrams is what's recommended the RDAs or RDIs, okay? Here's our advanced information. Dr. Benzinger's advanced information. Energy production, that's big. 3 important processes. It causes oxidation of amino acids, which is proteins. Synthesis, or in other words, making, and oxidation of fatty acids. Big protection against disease in this area. And oxidation and utilization of glucose, sugar, okay? Thyroid hormone metabolism is very dependent on B2 riboflavin. And the more tissue damage that occurs, such as you're exercising a lot under a highly stressful situation, you're in a physical job on a consistent basis. You go out on the weekends, every weekend, and just bust your tail taking care of all the house issues. You're so exhausted and sore on Monday, not just because of muscle soreness, but it might be that B2 is a little bit low and it might make you a little sore than you should be. But burns, surgery, if you're going into surgery, B2 is going to be needed on a higher level. Injuries, fever, and malignancy such as cancer, okay? In the blood, riboflavin deficiency may end up with anemia. Okay? Red blood cell production may slow, causing anemia. Some studies indicate that it works with iron in the red blood cell. So if you're taking the iron, you can't get your red blood cells working right, or something called the hemoglobin is not looking good in the blood. The heme itself is not forming. B2 could be another issue, and many times docs will overlook this, just like anyone else. Sickle cell anemia patients may demand more riboflavin than other patients, and that's something to consider too. Look at the immune system. Animal studies have demonstrated that riboflavin deficiencies reduce the body's ability to make antibodies. In other words, fight disease, bacterial and viral diseases. Okay? Other animal studies suggest that deficiencies increase susceptibility to esophageal cancer. So for the immune system, B2 is a big deal. Let's look at vision for a second in our advanced information. Riboflavin is essential for the eyes, essential. If it's not there, eye function and focus and the ability to see when it's darker, in other words, night vision problems, riboflavin is a big issue. So is vitamin A, and we've already covered that in another session, so make sure you pick that up if you haven't gotten it. It's found in the pigment of the eye. It helps the eye adapt to light. So if it's not there, you're not going to adapt to light. It's either going to be too bright or it's going to be too dull. But deficiencies make you susceptible. When you walk out into bright light and it causes your eyes actually to water in response, B2 is something to think about. Blurred vision, cataracts can be helped by B2. The nervous system found deficiencies in psychiatric patients. We don't know, sometimes it's because of the medications they're on, or they just have a deficiency. Psychiatric patients, schizophrenia, bipolar, etc., etc. Carpal tunnel syndromes may be helped. You've heard of B6 for that. Well, B2, that's why I don't like seeing them taken individually. I like to see them conjointly taken together. So the possible benefits of it, energy production of riboflavin is improved. Thyroid hormone metabolism is improved. And for those that are having weight problems and thyroid issues and are on Synthroid and things aren't working very well, B2 addition might be, or a B complex might be helpful. Blood formation, if your anemia is not getting corrected, this might be a possibility. Talk to your doctor. Immune systems get stronger when riboflavin is plentiful in your body. Vision seems to improve. Nervous systems such as carpal tunnel conditions seem to get better too. So B2, an important, very important nutrient, water soluble, basically impossible to become toxic on unless you're just ridiculous, and we're not suggesting that. But is it an important nutrient to have in your diet on a daily basis? The answer is absolutely. We hope you've enjoyed today's just educational session. We hope you tell your family and friends about this so you can get more and more of this type of information in you, because once you're armed with the information, you can start helping yourself and your friends and family feel better and have a healthier, longer quality of life than you have before. We'll look for you next time. Make sure you're signed up at secondopinion.org for the free newsletter that lets you know all the seminars and all the educational stuff and all the book reviews and all the article reviews that we do for you to try to help you enhance the quality of your life and your health. This is Dr. Benzinger on Health for secondopinion.org. We'll look for you next time. May God bless you.